Welcome to today's video where we will be exploring a very common yet serious health condition known as alcoholic liver disease. So this condition is directly linked to excessive alcohol consumption and can have detrimental effects on the liver. So join me as we will delve into the causes, symptoms, diagnosis and treatment of alcoholic liver disease in a way that is easy to understand. Alcoholic liver disease, as we know, is caused by drinking too much of alcohol over a long period of time. So, when we consume alcohol, our liver works hard to break it down. However, if we drink excessively, the liver can become overwhelmed. This leads to buildup of harmful byproducts that damages the liver cells. Over time, this damage can progress to inflammation and scarring, ultimately affecting the liver's ability to function properly. No, I will tell you the easy way to remember the causes of alcohol liver disease. You just think of your liver as a superhero that protects your body from various toxins like alcohol. But when we drink too much of alcohol, it's like sending the liver into the battle again and again. The liver tries its best to break down the alcohol, but with excessive drinking, it gets tired and starts getting hurt. This repeated damage can lead to the alcoholic liver disease. Now, there are more ways that help you to remember the cause of alcohol liver disease. For example, you just imagine your liver as a filter that cleans out toxins from your body. Now, when we drink too much alcohol, it's like pouring a ton of dirt into the filter. Over time, the filter, that is your liver, gets clogged and damaged, causing alcoholic liver disease. Now, there are certain more ways that help you to remember the cause of alcohol liver disease. For example, you just picture your liver as a hard working factory that processes everything you consume. Now, when we overload it with alcohol, it's like running the factory at a full speed to 24 into 7. Eventually, the machine starts breaking down, and the factory, that is your liver, suffers from the damage leading to the alcoholic liver disease. Let's dive into the common symptom you should be aware of. First, let's talk about fatigue. Do you often feel tired and weak even after getting enough rest? This could be a sign of underlying alcoholic liver disease. Next, jaundice. Have you noticed the yellowing of your skin or eyes? This is a common indicator of liver dysfunction. Abdominal pain is another symptom to watch out for. If you experience pain or discomfort in the upper right side of your abdomen, it could be a sign of liver damage. Swelling is also a common symptom of alcohol liver disease. If you notice swelling in your legs or abdomen, it could be due to fluid buildup caused by liver damage. Loss of appetite and unexplained weight loss are other signs to pay attention to. Here, your liver's ability to process nutrients may be impacted. Feeling nauseous and vomiting could also be linked to liver distress. It's important not to ignore these symptoms. Lastly, confusion and difficulty concentrating may rise due to toxins not being properly filtered by the damaged liver. Hey guys, so if you suspect you have alcohol liver disease because of heavy drinking, here's how doctor figure it out. You start by talking to your doctor about your drinking habits, health history, and any symptoms you may have like feeling tired all the time or noticing your skin turning yellow. Next up, they will draw some blood to check your liver enzymes and see if they are elevated. High levels could mean your liver is not happy. You might get an ultrasound, which is like a cool peek inside your belly to look at your liver. They are checking for any signs of trouble like liver swelling or fatty liver. Sometimes they use these things called a fibroscan to measure how stiff your liver is. The stiffer it is, the more likely there is serious damage. In some cases, they might do a liver biopsy. Don't worry, it's just a teeny piece of liver. They are checking how bad your liver is. They will also check for hepatitis and other liver disease because sometimes it's not just drinking causing the issues. So, all these tests help the doctor to figure out if it's really alcohol liver disease and how bad it is. Remember, it's important to be honest with your doctor about your drinking habits. So, let's dive into the crucial topic of treating alcoholic liver disease. This condition, as we know, stems from prolonged alcohol abuse and can have serious implications for one's health. So, treating alcohol liver disease involves a comprehensive approach, starting with the fundamental step of abstaining from the alcohol completely. This disease is paramount in halting further liver damage and potentially allowing for some degree of recovery. Nutrition therapy plays a key role in the treatment process. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins is essential for individuals with alcoholic liver disease. In certain cases, nutritional supplements may be recommended to address deficiencies. Medications also play a key role in managing alcoholic liver disease. Corticosteroids may be prescribed to reduce the liver inflammation in severe cases of alcoholic hepatitis. Ursodeoxycholic acid can help improve bile flow in specific situations. Antioxidants like vitamin E may be suggested to combat oxidative stress in the liver. When complications arises, targeted treatments are necessary. For ascites and edema, diuretics can help reduce fluid retention. Portal hypertension can be managed with medications or procedures to address high blood pressure in the portal vein. Hepatic encephalopathy symptoms may be alleviated with medications to manage confusion and related issues. In advanced cases of cirrhosis, where the liver is significantly damaged, a liver transplant may be the only viable option for treatment. To sum up, the treatment of alcohol liver disease involves a holistic approach encompassing alcoholic abstinence, nutritional therapy, medications, and managing complications. Early intervention and lifestyle modification are crucial for better outcomes and preventing further liver damage. Remember, seeking help from a healthcare professional is key if you or someone you know is struggling with alcohol abuse. Thank you for tuning in and stay tuned for enlightening lectures.